Okay, I've got 1 o'clock, so why don't we go ahead and get started. Everybody, thank you so much for taking the time to join us today. We're going to be talking about a few things, but really this is about best practices toward strengthening your organization's overall security. And why is this so important today? Well, there's a couple of reasons. First and foremost is that 75% of all the breaches reported to HHS were hacking IT incidents. And just in the last 3 years alone, we've had nearly 4,400 of such incidents. And one of the big challenges is that they are absolutely targeting smaller healthcare organizations. Over 20% of them have already experienced some sort of breach. And that means once they have that information, they likely don't need it again. So they're targeting the remaining 8% that haven't yet had a breach. So for those of you that I haven't met before, my name is Toby Morrison. I am Senior Director of Sales here at Enterprise Health. If you're not familiar with us, I have an exceptional team of healthcare security professionals that have been doing this for a very long time, former OCR auditors on staff, former assessors. And really what we do is we provide software that helps you protect yourselves in a much more comprehensive fashion than you may necessarily be doing today. We have a 100% success rate responding to and passing OCR audits. And we do this through a series of software-enabled tools that we'll talk to you a little bit about in a few moments. But we are also joined by my teammate, Dave Stadler, and I will let Dave introduce himself.
Thanks, Toby. Everybody, I'm Dave Stalder, for those of you who don't know me. I've dedicated the last 3 decades of my professional career to healthcare in various different forms across healthcare IT, healthcare finance, and a variety of very large companies like General Electric, and running my own healthcare IT consulting company. So I've seen a lot of different things, and for the past year and a half, I've been with NetGain. NetGain's been around for over 25 years, dedicated much of its experience to healthcare, so we understand PHI, we understand the unique needs of healthcare, and we deliver our services as a managed IT service provider to varying types of private practices, public clinics, and small hospitals. We offer managed security services and cloud adoption and cloud hosting services, along with healthcare IT consulting for a variety of different IT projects. One of the things, if you go to the next slide, that we want to just kind of describe for you is why Toby and I are here together. Enterprise, as a software and services company dedicated to security, we fundamentally are partnering together to allow Enterprise to conduct ongoing, which they do, SRAs and pen tests to help healthcare organizations often remediate some of these vulnerabilities that are found. And then often in certain circumstances, there might be a need for ongoing management of a security posture or an IT environment going forward. And those are the pieces that NetGain can possibly help you with as healthcare providers. But to give some context, if you go to the next slide, we all recognize that the challenge in healthcare is not small, in that revenue and reimbursement continues to decline on a fee-for-service basis. Here are 2 examples of notable declines over the last year from CMS. The costs of delivering healthcare services is notably up through inflationary pressures like staffing and complexity around IT. We're talking today about security, so cybersecurity is top of mind for everyone, as Toby outlined with the number of attacks that have repeatedly gone on in healthcare. Plus, continued electronic health record enhancements and emerging technology to capture additional revenue in alternative payment models. There's a lot of things going on that are making just delivering IT within healthcare much more complicated. And then fundamentally, the resources associated with delivering IT in healthcare have been lowered. So there's just less staff per physician across the board, both clinically and administratively. And budgets are either flat or reduced. So the question is, how do you do more with less in healthcare in the context of security? So I'm going to pass it back to Toby to talk about why we're together and how the process might work, for whether it's done through our services or your own volition, a really best practice around SRAs and pen testing. So go ahead, Toby.
Thanks, Dave. So as you mentioned, it starts with the security risk assessment. If you guys aren't overly familiar with that, it is the requirement under HIPAA, especially under MIPS, that you are required to perform periodic technical and non-technical evaluations of essentially of your organization's ability to meet the requirements of the security role. So really what it is, the SRA is more or less the foundational bedrock of your security posture overall. It's the set of policies and procedures that are in place, everything from what happens if Dr. X loses their phone, to if we have an actual breach, to if we have a phishing attack. It's all that kind of summed into one. So the SRA, what that does first is helps you understand your risk based upon your policies and procedures. Then step two, once you've understood what the assessment tells you and where you've got potential risks, then you need to actually look for live vulnerabilities. And that's what pen testing is. So what's your penetration testing rather? What you're looking at on screen right now, this is an actual ransomware node. I hope that nobody on this call has ever seen one of these before, but it kind of puts it right out there. And you may be wondering what's happening here, but it may let us explain. Maybe seem complicated, it's not. Most likely what happens is you decide to save some money on your security infrastructure. Also, alas, as a result, your critical data that was not only encrypted, but also copied from your systems on a secure server. So now once you've gotten this node, now you're dealing with the data breach, and now you're dealing with potential OCR audits, fines, not to mention all the attorney fees and everything else that go along with that. So how can we avoid this from happening? And that's really what penetration test is. So there are three flavors of penetration testing. First is what we call bad actor. And I want to be very clear, this is the one that we're proposing for this group today. This is the one that's really the most important. But this is where we essentially have an ethical hacker pretend that they are a bad guy. And they have nothing but your IP address, and they just try to get in and get some valuable data. This is the one that will help you really understand where your biggest risks are. However, there are two other versions. You've also got the rogue employee. This is where I may be authenticated already, right? I may be an entry-level employee, but I want to see if I can elevate my positions horizontally or vertically. Essentially, can I impersonate somebody else, or can I become a different admin? And then finally is application software testing. Candidly, most of the folks on this call will not need this. This is where we're looking for specific vulnerabilities inside an application. The bad actor is really the one that we're talking about here today, and the one that's absolutely the most important. So with that, I'm going to pass it back over to Dave to talk a little bit about the approach once we do the security risk assessment, then we do some penetration testing, then we need to start remediation, and that's where Dave really comes into the picture.
Right. So just to highlight what Toby just discussed, many times, whether the SRA is completed by the provider as a self-assessment or through a third party, the penetration testing needs to be, a bona fide test of the environment as if a bad actor were coming in. So that is exactly what would be the best practice recommendation, is to have that pen testing done. And then once those vulnerabilities are discovered, the remediation can be sometimes very simple and sometimes uniquely complicated depending on where the vulnerability is. So what the partnership between Enterprise and NetGain is that when those vulnerabilities are discovered and organizations need additional assistance for remediation, you could contact the third party, in this case NetGain, to help you identify potential solutions and remediations for those vulnerabilities, such that once those remediations are resolved, then Enterprise would come back in and provide an attestation letter that you've either fixed or working on the required remediations to comply with your assessment for your annual requirement with HIPAA. Toby, do you want to say any more to that, or any of the risks associated with noncompliance?
Yeah, I think it's pretty important to talk about those risks, Dave. Before we kind of get to starting to talk about the most common breaches and potential remediations, I touched on it before, but there was a medical practice. I believe they had 5 doctors in December that experienced a day. Sorry, the fine was issued in December. The data breach actually happened in 21. Their fine was $23,000. Just estimating how much time it took them to fight this, to appeal it, to have to remediate, have to hire an additional consultant, have to the potential loss of patients. We didn't even factor that in. Estimating it took about $120,000 before you even start factoring the fine. So for smaller practices, that can be an absolute practice killer. So how we do the assessments in the first place is take you through a very simple TurboTax-like approach. Super easy question-based engine. If people don't have templates, they don't have policy procedures, we can absolutely help them write those and put them in place, then help you understand where those risks are. Every year you should be doing a penetration test as well. Then Dave's team comes in and does the remediation. Then we provide you the attestation letter so that if OCR does ever come knocking, your audit will be passed.
Thanks, Toby. Now, if you go to the next slide, we can kind of talk about some of the most common types of breaches and some most common remediations that we often see. So the first is clearly top of mind for not just healthcare providers, but it is uniquely targeted at smaller and large healthcare organizations through phishing attacks. And phishing is defined as an email threat that comes in to any user's environment as if they were a known person or a known entity, and you click on a link inadvertently, and then the next thing you know, you've allowed the bad actor in. And so that is by far the number one methodology of getting into an environment. Separately, another type of breach is the ransomware attack, where they take control of a server or a computer or patient data in this example and lock it down until such time as a payment is made and or the bad actor decides that they've received enough money or enough of what they're looking for to release the data. The third most common breach is simply a walk away of equipment where an employee or former employee either loses or walks away with patient data using corporate hardware or a phone or USB equipment. The fourth is obviously just accidental, where an email might be sent with PHI to an unsecured email address, and again, it's PHI, and that can't happen, and that often it qualifies as a breach and has to be dealt with accordingly. And then finally, the last is attacks through actual medical devices that are connected to the internet. When we see, not in any correlated order, but we see the major ways to remediate these kinds of attacks are really through a very strong policy and maintenance of password management and access. And there's a variety of different tools and processes that we use for managing our clients' environments to ensure that these kinds of breaches aren't causing problems. Another very large opportunity that we see in healthcare is email, and moving to O365, for example, is a much more secure environment than some legacy email exchanges and other applications that might be more vulnerable than an O365 environment that is managed appropriately, including other server operating systems that need patching and updating just to stay current, making them much less vulnerable. Finally, user training and tools like antivirus are critical in keeping environments safe. And when we run into an environment that has not kept up with any of these four major items, including the repeated training associated with users just not clicking on the wrong links, these are the opportunities that we run into that we often fix for our managed clients and can help organizations get to a higher level of security in the long run. Next slide. And to illustrate that, this is just an example of one of our managed clients' scorecards. It's a mock-up showing their current vulnerability as managed through NetGain as a hosting and managed service provider. And in this example, you'll see that top vulnerability management category. There's no real severe threats there, but there are some certificates that the client and we would be pointing out to help update. And then as we go down into each of the endpoints, we would look at each endpoint and look at the opportunities to update and manage those endpoints in a very secure way, along with the final category, which is really their password policies and their domain administration security around not only email, but other risky applications that maybe third-party vendors might need to access and manage their environments. Finally, on the next slide, Toby, one of the things that we certainly stress is that, number one, managed security is not a destination, it's a journey, and it requires ongoing maintenance and investment such that it's not simply one of these layers of defense, it's all of them in terms of the network and perimeter safety, endpoint management or device management, application security from all ends, making sure your data is encrypted and classified in the right level of security from a PHI perspective, and then really some of the fundamentals around log management for HIPAA compliance and incident management. And per what Toby and I are really talking about is this notion of, hey, risk assessments and penetration testing really should be just an annual best practice that you endeavor to put on your calendar, so that as the environments and your vendor sets change, that you're up to snuff with the latest, greatest security that you can possibly deliver for your organization. I'll turn it back over to you, Toby.
Thanks, Dave. So just to recap a few of the things that we've talked about today, bad actors are increasing, right? Almost 4,500 attacks over the last 3 years. There were roughly another 700 in 2022 as well. The numbers just came out recently. They're still being compiled through the end of the year, but we're already over 700 attacks for 22, and several have come in already this year. So they are continuing to go after healthcare because this is the most valuable information that you can find on the dark web, even more valuable than credit cards. So remember that the HIPAA security rule requires covered entities like yourselves to perform a periodic assessment of your security policies and procedures. That SRA, the SRA that actually covers that specific ask of the government, is going to reveal potential risks in your overall security stance. Then the penetration testing that we talked about reveals the actual live vulnerabilities. Remediation addresses these risks, builds your book of evidence, protects you and your patients most of all. But the best way to approach healthcare IT security, it is a living, breathing thing. It requires ongoing management, requires ongoing investment in people, processes, training, and tools to ensure that you are both keeping yourselves and your patients' data safe, and candidly out of the eyes of OCR, because nobody wants to show up on the resolution agreement website. So with that, Dave, is there anything else you wanted to add before we turned over to the audience for any questions they may have?
Yeah, I just to echo what you said, Toby, I think the biggest challenge that we see is notably when we get involved with a new client or somebody who's just looking for, some services as help, is that historically healthcare as a general rule has underinvested in IT in general. And then when you look at security investment as a subset of IT investment, it's really lagging behind, and it's tough because smaller healthcare organizations and even mid-sized healthcare organizations just don't have a lot of resource to plow into what would be described as an enterprise grade security platform. And so while we all understand the challenges, it doesn't make it necessarily easy. And I guess what we're here to do is to say, if you need help, we would love to help you through any and all of these kinds of solutions. There's a way for organizations to get where they need to be compliant. However, it's not as simple as buying a piece of software and installing it. Typically, it goes to that last point where it requires an ongoing diet of investment and management and lots of different things.
Couldn't agree more. Well, thank you for that, Dave. So with that, we would love to hear from you. If there are any questions that you have before we end the webinar, please feel free to ask them now. Otherwise, we are going to put up a poll in just a moment. And if you'd like us to follow up with you, if you have any specific questions you don't want to ask in front of the group, we can certainly reach out to you after the webinar. But with that, we will say thank you for your time. Thank you for your interest, and we look forward to speaking with you soon.